So today we're going to be giving Trevor Rich his metoclopramide injection because he's feeling a little bit nauseated after his surgery this morning. So the first thing I'm going to do is perform my hand hygiene using the alcohol-based rub. And the second thing I'm going to do is make sure that my drug chart is a valid and legal drug chart and we have a valid and legal order. So the first thing that we do is make sure that the patient has their ID label on both the back and the front of the chart, as well as making sure that the first prescriber has provided the patient's surname and provided the patient's weight and height. We also need to make sure that the allergies and adverse drug reactions section has been completed. In this case, nil known has been ticked and it has been completed by one of the clinicians. We will also check with Trevor when we go to the bedside to make sure that he is not allergic to anything. Finally, we make sure that the year is valid. In this case, it is 2019. Turning to the back in the PRN or as required section and having a look at our order, we have an order for metoclopramide, which we can give intravenous or intramuscular, 10 to 20 milligrams every 6 hours. Our maximum dose in 24 hours is filled out. Our indication for nausea, and we've already mentioned Trevor is feeling a bit unwell after his surgery, and the prescriber has completed their section, including their signature, their name, and their contact details. And it's all very readable and legible, so that is a valid and legal order. What I'm going to do now is check to make sure that I have got the right medication. We have an order for metoclopramide 10 milligrams. We have got metoclopramide 10 milligrams in 2 ml, so we will use the entire 2 ml solution, and it expires in January 2022. So the medication itself looks okay, it's clear, and there doesn't appear anything wrong with the medication. What I'm going to do now is I'm going to take my syringe and I'm going to open the syringe halfway, and then I'm going to hold that. I'm also going to open my drawing up needle halfway, being sure not to contaminate the hub, or in this case the pink part of the needle. I'm going to remove the syringe from the packet and firmly push the syringe into the hub of the needle, and then discard my rubbish directly into the rubbish bin. What I'm going to do now is I'm going to place that down on my trolley, and I'm going to hold the ampule so that the air is facing towards the roof, and I'm now going to snap the plastic ampule open and throw that into the rubbish, being careful not to touch the sterile section that we've just opened. I'm now going to uncap the needle and throw that directly into the bin, and then carefully place the needle into the plastic ampule, invert the plastic ampule, and then pull back on the plunger to withdraw the medication. And we know that we need 2 ml of medication to deliver 10 milligrams of metoclopramide. So we take the medication. I'm going to place the plastic ampule down in the kidney dish upright in case I need to return to collect some more medication. I'm going to pull down on the plunger to allow some air to form in the top of the syringe, and I'm then going to flick the syringe to get rid of any air bubbles that have accumulated in the liquid. I'm then going to push the plunger back so that the top of the plunger is directly level with the 2 ml line. So you can see there we have 2 millilitres of metoclopramide. I'm now going to engage the safety device to reduce the risk of needle stick injuries. What I'm going to do now is open up my giving needle, in this case a 23 gauge needle for intramuscular injection. Again, being careful in this case not to touch the blue hub of the needle. I'm going to carefully twist and remove the drawing up needle and dispose of that directly into the sharps container, and then being careful not to contaminate either sterile end, connect the syringe to the hub of the needle, making sure that it's firmly inserted, and I'm going to throw the plastic into the rubbish bin. I'm going to place the syringe and needle into the kidney dish with my alcohol swab, and I no longer require the medication because we've checked the medication, the dose, and the expiry is correct, so I'm going to discard that into the rubbish as well. What I'm going to do now is perform hand hygiene again as we approach the patient, and I'm going to make sure that I have the right patient, and I'm going to ask about allergies. Trevor, my name's James. I'm one of the nurses here today, and I'm going to give you some medication to help with your nausea after your surgery this morning. Could you please tell me your full name and date of birth?
It's Trevor Rich, and it's the 3rd of the 10th, 1965.
Fantastic. And are you allergic to anything, Trevor?
No, I've got no allergies.
Thank you. And we confirm that by Trevor not having a red name band and the allergy section being ticked for nil known allergies or adverse drug reactions. What I'm going to do now is check to make sure that the name band matches the drug chart. So we have Trevor Rich, 3rd of the 10th, 1965, patient number 503223, patient number 503223, Trevor Rich, 3rd of the 10th, 1965, and that matches both the back and the front of this medication chart. I'm going to perform my hand hygiene again and apply my gloves and then prepare the patient. I'm going to bring my kidney dish closer, but I'm not going to place it on the bed in case Trevor moves and overturns the kidney dish onto the floor. What I'm going to do now is prepare the patient, so I'm going to uncover Trevor, being sure to preserve Trevor's dignity and only expose the area that's required. I'm now going to have a look at the skin of the thigh here, and I can see that there's no bruising, there's no mottling, there's no incisions, and there's no lumps or anything that would mean I couldn't use this injection site. We're aiming to use the middle third of the anterior lateral thigh, so right in this section here. I'm now going to take my alcohol swab and I'm going to start in the centre, and then I'm going to work my way in consecutively larger circles moving away from the injection point, and I'm going to then throw that into the bin. And I'm not going to fan the site to dry it, instead I'm going to allow it to air dry for 30 seconds. Whilst that's drying, I'm going to get my medication and I'm going to take the cap off and discard that into the rubbish. I'm going to hold the syringe and the hub of the needle like a dart. With an intramuscular injection, we want to spread the subcutaneous tissue, so I'm going to put my fingers close to the injection site, push down and then spread them away. And on the count of 3, Trevor, I'm going to inject on a 90-degree angle. 1, 2, 3. I'm going to stabilise the hub of the needle with my left hand and slowly inject the medication at a rate of no more than 1 ml per 10 seconds. I'm then going to move my left hand away from the site of the needle to avoid needle stick injury and quickly withdraw the needle from the skin. I'm then going to engage the safety device to reduce the risk of needle stick injury, and then I'm going to discard both directly into the sharps container. I check the site to make sure there's no bruising or bleeding, and then I return the patient to their original position, and I can let Trevor know that if he still feels unwell, he can let the nursing staff know. I'm now going to remove my gloves, perform my hand hygiene again, and finally, to complete the process, I'm going to document on the drug chart. So here's our order for metoclopramide. I'm going to put today for today's date, and the time is now 1600. The dose, because there was a range, was 10 milligrams. The route, again, there was a choice between intravenous and intramuscular, so we're going to write IM for intramuscular, and then I'm going to sign that I have given that medication to the patient.